Thank you for watching this presentation. My name is Pam Davis from Alzheimer's Australia, and this was filmed during a live workshop that was funded through the Northside Community Forum, and it covered a number of topics for family carers to help them to understand a little bit about dementia, communication, behaviours and services. While there's some resistance and barriers to using services, what are the advantages of using services, and also some of the services that are available out there in the community? And we know the government is supporting people to remain in their own homes for as long as possible. So there are more and more services being funded out in the community. Our web pages have a huge amount of information that you can download that will be a valuable resource for you caring in your homes. Information for the person with dementia, information on problems that you may be encountering, on changes that may be happening. I would really suggest that you access those materials because they will be a valuable asset to you at home. Well, thank you for coming today. We're covering some information on understanding a little bit about dementia. What I'm hoping to just give you information about is what dementia is, how it actually affects the person, and some of the causes of dementia. Now, I'm not sure if any of you know the difference between Alzheimer's and dementia, but that's always a question that we get asked in just about every session that we run. And it's important to know that Alzheimer's is just one type of dementia. I use the analogy often of the car, and I say if you think of the word dementia like the word car, and you think of the word Alzheimer's like you use the word Toyota, Alzheimer's is just one kind of dementia, the same as Toyota is just one kind of car. And there are about 130 different types of dementia. And I'm not going to go through all of them. The top ones that we hear about are Alzheimer's disease, vascular dementia, which is to do with circulation of blood to the brain, and frontotemporal dementia with Lewy bodies. And I'll tell you a little bit about them as we go through this, although not in huge detail. I'm also going to just briefly tell you there are some things that look like dementia that aren't. So sometimes a person shows some symptoms and you think they might be dementia, but when you investigate further you discover that perhaps they have depression or some sort of other treatable illness. Dementia actually affects all people. It's not exclusive, it's not discriminatory, it just affects people, usually older people, but I'd say over 65 is the most common, and the older you are, the greater your risk. But we do see people in their younger years, 30, 40, 50, who also get dementia. It can happen to anybody, and it's an unfortunate thing that happens. It's not a natural or normal part of aging, which I think is an important point to remember. Because if you think it's a normal part of aging, you actually don't investigate what's happening, nor do you treat it. The brain's actually quite a complex organ, and different parts of the brain do different things. So our frontal lobe, which is really important in humans, is the part of our brain that's like our executive centre. So if the brain was a factory, that would be the part of the brain that actually is the CEO, the managing director, does everything, organises people, gets the feedback, makes decisions, plans, does all those sort of things. So without the frontal lobe, we really can't function very well. And for a lot of people with dementia, the frontal lobe gets affected quite early on. The temporal lobes are all about auditory information. So that's about what we hear. So language is very important. And if that's damaged, then of course you have trouble understanding what people are saying to you, or understanding how to structure sentences or speak or use words constructively. The parietal lobes up here are all about spatial orientation, knowing where you are in relation to other things. So knowing how to sit in the chair, how far away it is from you, how deep steps are, where you are in the room, how to get through the door without banging yourself, how to find the bathroom. So a lot of people with dementia have parietal lobe damage, which means that they get lost in familiar areas. They have difficulty doing sequences of tasks that we take for granted. It's also the part of our brain that manages our money, so it calculates, it helps us work out what we've got. It's also around reading, writing, telling the time. So when that's damaged, you can see why people go to the shops and they hand out their wallet and they just say to the shopkeeper, you take what you need, because they can't work out how much to give if the amount is $1.49. Further in the back is our visual part, the occipital lobe, which helps us to recognize people and things and anything to do with vision and visual processing. But deep inside the brain is a part called the limbic system, which is very important in dementing illnesses, because that's really where Alzheimer's starts, deep inside there. And when that part of the brain is where we formulate our memories. So we don't make our memories there, but we take the memories from all the parts of the brain where they've come in, and that part of the brain lays them down, if you like, into a working memory. So that's why people who have Alzheimer's disease, the very first thing is they don't have any short-term memory, because that part of the brain doesn't allow the memory to lay down, if you like, or settle there. Talking about the impact of dementia, and we know that one of the main impacts is memory loss, but it's not the memory loss of all memory. It starts with short-term memory loss. So it's what happened 5 minutes ago, yesterday, last week, but the memory of long ago is usually pretty intact, which is why reminiscence is a really wonderful strategy to use with somebody with dementia, because they remember the past really well, although they certainly can't remember what your name is or your relationship. Thinking is affected, so ability to organize your thoughts, to use abstract thought. Planning is affected, so organizing what you need to do next. I mean, everybody to get here today had to plan. You had to work out what time you were leaving, how long it would take you, where you were going to park. And we do that every day without thinking. But when planning is impacted, you can imagine that it would be really hard to get through your day if you had no planning capacity. Paying attention is a really big thing, and people with dementia have a really short attention span. So they jump from one thing to the next, and they're easily diverted, and they don't have any real lengthy concentration. Behavior is affected. So somebody with dementia often has some behaviors that might challenge the carer or might be difficult to manage. But it's part of the brain that is damaged, and also the way people interact with them may cause some behaviors. Physical function is affected, and over time that progresses. So they may start by perhaps having a few falls or being a little bit unsteady on their feet. Then it may change to being, having poor fine motor coordination, to being incontinent, to then perhaps having swallowing difficulties. And that is usually what ends up being the final stage for somebody with dementia, because once they can't swallow, they usually aspirate their own fluid and get pneumonia, choke, whatever. So dementia is actually the third leading cause of death in the world. So it's not as if it's just a disease process that you don't need to worry too much about. We've talked about language. Language is affected, and language thins, so the person loses concrete terminology, loses word-finding skills, and has difficulty putting sentences together in a structured way, and often substitutes words that make the sentence meaningless. So it becomes quite hard when you're trying to pick out what they're saying, and you need to sort of look for the key or the cues that trigger what they might be trying to tell you. Perception changes, perception perhaps of temperature or of hot or cold or appetite. So it can be frustrating for family carers, because they wonder why the person is sitting with 3 jumpers on the middle of a really hot day. But it's not that they choose to do that. It's just that they don't get that same sensation that tells them that they're hot. And because of all of those, and also because of other changes, emotions are very close to the surface. So somebody with dementia will have trouble really controlling their emotions, and those lead into behaviours. So when emotions can't be regulated, then behaviours usually occur. So some of the causes of dementia, I've talked about Alzheimer's, vascular, Lewy body, frontotemporal, Parkinson's. What happens is nearly all of them will have memory loss. They all have slightly different characteristics, but nearly all of them will have short-term memory loss as their main feature. Also then sequencing things and doing well-known tasks. You know, you knew how to make a cup of tea, and now the sequence making a cup of tea becomes too difficult. So they lose that ability, and then they rely on other people to help them. They may also become confused about where they are and what day it is and who you are. They'll make a lot of mistakes with their language. They may make some very bad judgments or decisions. It might be as simple as crossing the road when the red man's flashing, but it might be something really crazy like going and gambling huge amounts of money that you haven't got, or insisting that you can drive the car even though your license was long ago revoked. It starts often with problems just misplacing little things. But I have to reassure you that losing things doesn't mean you've got dementia. As we get older, all of us do silly things. We stand in a room and go, what did I come in here for? And then you've got to go back to where you started to try and trigger the memory that was why you went into that room in the first place. One of the things that is a real problem for carers is that initiator. The person with dementia loses the ability to get things started. So consequently, they sit in a corner and often just quietly sleep or do some repetitive behaviours, but they don't have the initiator that gets them up and going. And so as carers, we need to do that. We need to be the starter motor that gets them out of their chairs and involved or engaged in activities. But I have to tell you, the things that also can affect memory that aren't dementia are just being tired. And you all know when you're tired, you don't function as well as usual. When you're stressed or you're anxious, or if you're bereaved, if you've gone through grief recently, and it doesn't even have to be in the last week, month, it can be in the last few years. Everybody's different. Grief can actually impact on your ability to pay attention, so it does change your ability to remember things. Some medications can affect your memory, and I'm not saying stop your medications. I'm saying talk to your doctor and say, which of these am I taking that might actually be having an impact on my ability to remember things? Some nutritional deficiencies can affect your ability to remember things. Dehydration plays a big part, especially with older people, and especially when somebody already has dementia. They may have exacerbated memory loss because they don't drink enough fluid. And what happens when people don't drink enough is they often get a urinary tract infection, and then that can lead to something called delirium, which is a treatable, it's a sudden, acute, confusional episode that usually needs antibiotics to have it treated. And there are a number of causes for delirium. I'm not going to go through all of them, but certainly a urinary tract infection or another type of infection is a very common thing. Why do we need a diagnosis? That's often a question I get asked, because there's no cure for dementia. So people say, well, what's the point in even getting a diagnosis? I have to just say that a diagnosis is important because it helps you to treat the treatable causes. If you can have it separated out as what is dementia and what isn't, then you can treat those. And often, if you can treat some of the causes, you'll find that dementia is a very minor part, or maybe not even there. We just, we need to be able to eliminate those. And really, diagnosis is about eliminating the things that it isn't. So to get a proper diagnosis, usually the doctor will do a medical checkup, they will do a mini mental or use some sort of assessment tool to check your memory. They will also, if they're really worried about you, they'll send you off for a couple of scans, like perhaps an MRI or a CAT scan, just to see which parts of the brain are not functioning, or look and see if there's any other cause. It could be a tumour or something else that in a scan will come up. And of course, if a tumour is impacting on a part of the brain, it may have symptoms that look like dementia. So it really is important to eliminate everything else. If it is dementia, well, obviously then what we need to do is look at some of the treatments. There are, if it's vascular dementia, which is around circulation of blood to the brain, we need to then get the person on some sort of blood pressure medication, blood thinning medication, or something to help stop any more of these little mini strokes that might be causing the damage. If it's Alzheimer's disease, there are a number of different memory drugs which all have different pathways that they treat. But what they do is they usually assist the person for a period of time to function a bit better. It isn't a cure, but it is a way of maintaining them for a little bit longer on a plateau rather than a deterioration. Where to go to for help, of course, there are a range of different places. And certainly I would start with your GP. Then I would move on to the aged care assessment team at your local hospital to get a visit at home, because it's important. The doctor is only seeing the person for a very short window of time, and in that time the doctor can only make an assessment on how they present there and then. Because the doctor only sees them for this little space of time, and they often can perform reasonably well in that space, they don't always get the full picture. So I always say to carers, really, the biggest thing is let the doctor know what's happening before you do the visit, because there's nothing worse than talking in front of the person with dementia to the carer. It's belittling, it's demeaning, and it's very disrespectful of the person with dementia. So what we want to try and avoid is that you sitting in the surgery with the person with dementia and saying, oh, well, he's doing this and he's really not functioning here. What we want you to do is send the doctor a letter, give it to the receptionist, make an appointment yourself to see the doctor so that you can give them information ahead of time. So then when you go in, the doctor can know exactly what's happening and direct the investigation the way he wants or she wants it to be. Once you've seen the doctor and perhaps the ACAT team, you may be referred on to a specialist, which is usually a geriatrician if you're older, psychogeriatrician if there's some challenges there, a neurologist if the person perhaps is a younger person, and it's important that you then go and see one of those specialists. Our helpline, which you will be able to download any information you like about the services that Alzheimer's Australia runs. But the helpline, which has a 1-800 number, has trained counsellors online, so they can actually talk you through some of the issues. They can mail out some information to you that tell you what are some of the signs and symptoms you should be looking for, what do you need to do next. And if you're worried about your own brain health and thinking, how can I avoid getting dementia myself? What I would be saying is we also have a whole program called the Mind Your Mind program, which looks at dementia risk reduction. And what I would say there are 3 really key points in the Mind Your Mind program for you to look after your own health. And that is, keep your mind active. Do things that are stimulating and challenging and varied and interesting. When you're working, you're still doing those sort of things, but when you retire, often you stop being so involved in keeping your brain active. So you can build them into your recreation time. You can do things like mind games and jigsaws and crosswords and Sudoku and anything like that. Learn to use a computer. Learn to use your mobile phone. Most people only know how to use their phone to phone. But you know, the phone does a whole lot of things that if you can learn how to do it, that's a good mental challenge. Learn another language. That, you know, if you speak more than one language, you already have more neuronal pathways than anybody else. So it's really important that you keep your brain active. The second really important thing is to keep your body healthy. So exercise. Because exercise makes you breathe deeper, it sends more oxygen into the bloodstream, and the oxygen is what feeds the brain and makes it sharp and alert. So if you get lots of oxygen to the brain, you actually keep your brain healthy at the same time. So making sure you also do things that will stop you falling over. Don't climb up ladders and be silly or change light bulbs. Get one of the services to come in and do that. Because when you fall over and you're an older person, you usually end up breaking a bone. And then you go to hospital, and then you have an anesthetic, and then you're exposed to a whole lot of other germs in the hospital. And really, going to hospital is the thing you want to avoid when you get older. So doing things that will just keep you balanced. Tai Chi, yoga, simple exercises you can do, holding on the back of a chair and standing on your tiptoes and squatting. Those will help you to balance. And then the third really important thing is remaining socially engaged. So keeping connected with other people. Research shows that people who isolate themselves are more at risk of getting dementia. So we want to make sure that everybody talks to somebody every day, whether it's on the phone or face-to-face, best face-to-face, but any sort of interaction with others will help you to look after your own brain health. There are 7 signposts, but those 3 are probably the 3 key ones in reducing your risk of getting dementia. So what I do want to just reinforce is that each person with dementia is unique. Dementia affects everybody differently. There's no set pattern. People often ask, how long does it last? Well, we can't say. It depends on what age you are, what your general health is like, what kind of dementia you have, how long you've had it for. We know that dementia is actually, the pathological changes are happening in there about 20 years before the first symptom appears. So many of us may already be starting to brew this disease without even knowing about it. Any changes, sudden changes, need to be investigated with your doctor. So if you are noticing something happening with somebody that you are living with or caring for, have it investigated. It doesn't always have to be dementia. It may be something quite innocent, but if you don't check it out, you'll never find out. So I think that's probably enough just on understanding a little bit about dementia. I hope that's given you a bit of an overview. There are a number of courses that you can do on much more detailed information. But thank you very much for coming. Well, good morning, everybody, and welcome to this session. So I'm going to talk to you about communication and behaviours. What I would like to first do is dispel some of the myths about dementia. There are a lot of myths around, particularly in the Chinese culture. And one of them is that dementia is part of aging. It's a normal part of aging. Would you say breaking your leg was a normal part of aging? It's not. So we need to accept that dementia is a disease process that doesn't happen to everybody as they get older. I also want to say that dementia is not a mental illness. A mental illness is a chemical change in the brain, and dementia is a degenerative disease. So therefore, dementia is not a source of shame. These people don't have control about whether they get this disease. And do you know the difference between dementia and Alzheimer's disease? No? If I drew you a little picture. So dementia is just a describing word. It's an umbrella term. It's like the word cancer. It describes a whole lot of types of cancer. So dementia describes a whole lot of diseases of the brain. And Alzheimer's disease is just one of those many diseases. And it accounts for about 60% of all the kinds of dementia. There are about 130 different types of disease that come under this umbrella. Vascular dementia is another very common one. Dementia with Lewy bodies, alcohol-related dementia. So I'm not going to go through all the different types, but I just wanted you to understand that Alzheimer's disease is just one of the many types of dementia. Let's just have a look at what we're covering today. We're looking at how dementia changes communication. We're also going to look at ways to talk more effectively with people with dementia. And then we're going to look very briefly at some of the behaviors and how you can respond. But I do need to just remind you that everybody with dementia is unique. So dementia never affects two people in exactly the same way. Let's just have a look at why we communicate. We communicate to express our needs and our feelings. We also communicate to respond to the feelings and the needs of other people. We communicate to be part of a social group and to not feel alone. Why do you think communication is so important?
To understand everyone's feelings.
Yep, to understand feelings. So in everyday life, we need good communication skills. And the main way we communicate is through language. So the words we use is the most common way that we communicate. So to be able to understand effectively, we need to be able to know when we can speak and when somebody else needs a turn. We need to be able to listen effectively. We need to be able to read and write and send text messages and use computers and emails. But we also communicate with our bodies, don't we? The other way we communicate is with our facial expression. And you can tell how somebody's feeling by the way they look. And in dementia, many of those parts of the brain that change, they change as we get dementia, which means that often communication changes. But we can still communicate with somebody with dementia by using other skills. So we need to use body language and gestures and pointing and showing. Dementia must be a very frightening and lonely disease to have. So we need to be able to relieve the stress and the anxiety felt by people with dementia. And the way we can do that is often with showing affection or showing body language. A gentle pat on the hand or a hug can often alleviate a lot of stress for somebody with dementia. The person with dementia loses their ability to communicate as the disease progresses. So what we need to do as carers is change the way we communicate to make it more effective. The brain works a little bit like a factory, and each part of the factory has different jobs to do. But when parts of the factory aren't functioning, then parts of the person can't function. But as I said to you, each person with dementia is individual, and the damage in the brain depends very much on what kind of dementia they've got. But in all the dementias, communication is usually affected. And it gets progressively worse as the dementia progresses. And I'll just show you what's called a PET scan. This is a way of looking inside the brain and taking pictures to show which parts of the brain are working and which parts do what function. And chemicals are actually sent into the brain and they light up to give us an idea of which parts of the brain are damaged or working. So they tested people. These are not dead people, these are alive people who were reading, writing, speaking, or listening, and then they could see whether that part of the brain was working. So the first thing that is affected in dementia is memory. But it's not the memory of long ago. It's the memory of what happened just yesterday or 5 minutes ago. Which means that if you can't remember what somebody's just said to you or what word you want to use next, you can see how communication would be affected. Or you can't remember the places or the people or the events you want to talk about. Dementia can also affect how you produce speech. So what words you use or how you structure the sentence. So you put those two together and you may have a very slow, halting, difficult speech pattern. Dementia may also affect comprehension. So if you don't understand what somebody's saying to you, you can't understand what they mean. Or you may have difficulty answering a question or following instructions. The other thing that's affected in dementia is our insight. And insight is knowing how you're presenting in the world out there and what people think of your behavior. So for many people with dementia, they don't believe there's anything wrong with them. So it's very hard to correct them or to ask them why they're not doing something when, as far as they're concerned, they're doing it all perfectly well. So in other words, with communication, if they misunderstand a message, they'll think it's your fault. They'll be angry with you, not realizing that they don't understand it. Another thing that is affected is inhibition, which is, to describe it more simply, it's regulating how we behave. So for many people who have this damage in their frontal lobe, they lose inhibition. To make it more simple, what it means is that they may talk over the top of you, say things that are very hurtful and not realize that they're being unkind. And the other thing that's affected is concentration. So the person will have a very short attention span, which means we can't plan big things. We need to have lots of little things that change, because they won't be able to concentrate long enough to do anything for any length of time. But the person with dementia can still respond to your tone of voice and your body language. And they can communicate back to you through their body language and their facial expression. And they can usually respond to prompts or demonstrations or cues that show them what to do. Non-verbal communication, which is all the things we've talked about, facial expression, gestures, body language, are very important in dementia care. If you're feeling upset or angry, your body language is going to show that to the person with dementia. And that will mean that you upset them, and then it means communication is even more disturbed. So if you are upset, go away for 5 minutes and don't interact with the person and come back in a little while. Now, it's very easy to say don't get angry with the person, but when you're living with the disease, it's not as easy to do. But let's just look at some ways to interact more effectively. Slow down your speaking voice and speak more clearly. We speak very quickly. We don't realize it until we listen to a message on the phone and we realize we don't hear it all the first time. We have to listen again. Be aware of how you speak. We can say a sentence and it can have different meanings. The simple sentence of "I'm fine" can be "I'm fine," or it could be "Yeah, I'm fine." So the simple words can have many different connotations. But if you go away today with just one thing, what I would like you to do is never argue with the person with dementia. Because the reality they are in is not always the reality you're in. But it doesn't do any good to try and put them into your reality, because they believe the reality they are in. For example, if they're saying to you they want to go home, but they actually are at home, rather than you saying, "What are you thinking? You're at home," you might think about what home might mean for that person. What does home mean to all of us? It means safety, security, comfort, food. So maybe what the person is really meaning is, "I'm looking for somewhere where I feel safe." And therefore we might just use some reassurance for them. "We'll care for you. We're looking after you. Don't worry." The other thing we might think about is smiling a lot and making eye contact. It's very important for the person with dementia to know when you're going to speak to them. And the only way they know that is if you draw attention to that. And they might not be able to hear you in a room full of other people. But if you touch their arm or you make eye contact, they'll know you're speaking with them. Respond to the way they're behaving. So if they're looking sad and depressed or angry, you might say, "You're looking a bit upset, you're looking cross." Because if they feel like you're recognizing their feelings, they already will feel a little reassured. And if you're having trouble understanding what they're saying, focus on a word or a sentence and repeat it to them. Because they'll be very quick to tell you if that wasn't what they meant, but it will make them feel at least you are listening. Other ways to speak to somebody with dementia are to be aware of noises that are nearby. We know that people with dementia have great difficulty separating out the noises, so they can't tell whether you're speaking to them or whether it's the television. So it's really important to switch off all the distracting noises in the background before you converse with somebody. Ask only one question or one instruction at a time. We're very good at giving multiple directions. We say things like, "Now just get dressed and then we're going out and we'll have a coffee and we're doing this." And then we wonder why they haven't done anything. Also avoid testing them if you know the answer already. What that means is, don't say something like, "What did you do at the day centre today?" when you know they can't tell you the answer. What you need to do is find out what they did at the day centre and then say to them, "You must have had a lovely day, you did this, that and the other." And the last one is, make sure you're not standing over somebody with dementia that you want to talk to. Come down to their level. And when you're at their level, you're not trying to show who's the boss. You use simple words without being too patronizing, that is, without treating them like a child. Use a lot of concrete terms, nouns, people's names, names of objects. Because what happens with people with dementia is they lose the concrete terms and they start using very vague words. Whatchamacallit, thingamajigs, over there, that one, rather than saying what they mean. And try as much as possible to use your hands and gestures. Point, show. If they want something, ask. Point, "Did you want one of these?" rather than saying the words. The next part we're going to talk about is probably the part you're most interested in, and that is around behaviours. What I want you to tell me, perhaps, is what are some of the behaviours that you are encountering? Repetition. I'm writing them down so that I remember them, okay? Any others? Any others? Okay. So let's have a look at some of these and see if we can work out strategies. Let's look at repetition. And repetition is a very common behaviour. What happens is we have memory loss. So if I don't remember that I've just asked you that question, I will ask you again and again. But what that means is each time I ask it, I reinforce that neuronal pathway that strengthens that message. So therefore, that's what's in my brain, so I'm going to ask it again. And I'm going to keep asking it until you divert my attention. But what works sometimes is if you write the answer down on a piece of paper or in a little booklet, especially with men who always have a little notebook in their pockets. So you write down I live in Randwick. And when he asks you for the 6th time, you say, have a look in your book. And you might reinforce that behavior, which means that after a while they will look in their book anyway. That can work. Now, I have to point out that I can give you strategies, but because these are all individuals, what works for one may not work for another. So while I'm going to address these issues for you, we're going to look at a problem-solving approach where you can go through the problem step by step and try and work out your own answers. But if with the repetition you're giving them the answer every time as if it was the first time, that's a very good strategy. It can just be very tiring for the carer who has to keep saying it over and over. But the worst response is to say, you've already asked me that. Another strategy might be to have a whiteboard and you write down the things you want them to know. Or you may get the question of, what day is it today? So if you had a nice little board that said today was Tuesday the 1st of May, and each day you change that, the person wouldn't need to ask the question. Let's look at swearing. Now I need to just explain first of all that there's a part of our brain that's called our regulator. And that's the part that stops us doing things that might not be very nice or socially appropriate. Like I might have a rude joke that I think I'll tell you, but this part of my brain says, maybe not in this company. But for people who have damage there, it means that they don't have the regulator that stops them behaving or saying things that are inappropriate. Now, we all know swear words. Anybody in this room not know one swear word? So, when something is stored in your brain and you don't have the regulator, when you're frustrated or angry, you use the words that in normal circumstances you would not use. So, unfortunately, with swearing, we can't change the behavior. We might just have to learn to manage it. And that might be by ignoring it, going to places where it doesn't matter if that is swear, apologizing to friends and family and neighbors and saying, I'm sorry, I can't control that. Fortunately, if you explain to people what's happening, they are very understanding. Let's have a look at withdrawal or not communicating. So one of the issues here is that perhaps there's damage in the part of the brain that controls language, which means that the person loses language. And if you can't communicate with somebody, then there's no point in even trying. Plus, for most people with dementia, they tend to fail at most of the things they try, so they give up after a while. So what we need to do is encourage them to speak, to listen to them and make them feel valued. If they feel like they're contributing something worthwhile, then they will continue to speak. But isolating themselves is usually a survival technique. It's a way of stopping having to be tested on anything. Dementia also is very closely allied to depression. Some of the symptoms are very similar, but also if you have dementia, why wouldn't you feel depressed? And one of the symptoms that cover both depression and dementia is that the person loses interest in the things that they used to do. So therefore they will just sit and not seem to want to do anything. Another thing that contributes to that is, again, a part of the brain that is our starter motor fails. It's what gets us up and going every day. So when that part of the brain is damaged, the person can't get started on anything. But that doesn't mean you can't be their starter motor for them. So if you can encourage them to do something that you know they enjoyed in the past, once you get them going, they usually can do it. And in fact, the withdrawal is, to me, one of the biggest worries, because these people don't get attention because they're quiet. Let's just have a look at the people who are always telling you they're right. And again, I explained to you earlier that people with dementia lose insight. And one of the symptoms of that is that then they don't think there's anything wrong with them. So it doesn't matter what you say or what you want to do with them or help them for, they're going to tell you that they can do it themselves. And look, in many respects, we need to just let that go unless it's going to damage them or somebody else. But if they're telling you that black is white, well, let it be white. But if they want to tell you that they need to get in the car and drive and you know they haven't had a license for 5 years, then you need to do something about it. Refuses personal care. That's a very common thing where the person tells you they've already had a shower or they don't need a shower. For example, is it important to shower every day?
Well, when you are incontinent, yes.
Okay. Yes. And that is a very important point. If a person is just an elderly person with dementia and chooses not to shower every day, good on them. Just because we like to shower every day doesn't mean that an older person should or needs a shower every day. Older people's skin gets very fragile, it gets very dry, and too much soap and water can make it worse. But if the person is incontinent, then we definitely need to wash, not necessarily shower. It could be a bowl wash. And a bird bath, as we call it, is a very effective way of getting clean. Because for the person with dementia, they have no memory of when they last showered. So they may believe they just had a shower this morning. We're not sure how much pain a person with dementia is in. And sometimes a shower can be quite a painful thing. You know, they may have arthritis, moving their joints, stepping into the shower, having to lift their arms, and those can all be quite painful tasks. Plus the shower can be a very frightening place. There's water that you've got to get the right temperature, and that can be difficult. You have to take your clothes off, and how undignified is that if you've never shown your naked body to anybody before? And usually somebody wants to come in and help you, which is not a normal thing when you have a shower. So that might give you a reason why people don't want to have a shower. Because don't forget, the person is going back to memories from long ago. So the shower is a new invention, really. It's not something they did in the past. They probably had a big tub and washed. Memory is, I've used my board, but if I draw you a little, we've got a little onion here. I want you to think about memory starting from life beginning, right in the core there. So everything that's happened from then on is laid down like a new memory. As dementia starts, the damage occurs on the outer surfaces of the brain. For example, all the people that you're dealing with would have Cantonese or Mandarin as their mother tongue. And when they came to Australia, about this point, they learned English. So what happens as they get dementia is that they no longer can speak English because all the damage has been in the surfaces of the brain where the more recent language was housed. It's not as simple as that because those onion skins are too defined and the brain is a little more flexible than that. But it is just a way to illustrate that really when damage occurs out here, you have pockets of intact memory that's more recent, but a lot of the memories are from way back. So we can't always resolve issues, but as I say, we will look at some processes that you can go through. Appetite changes. Sometimes people eat everything that's put in front of them and everybody else's food. Sometimes they're not hungry at all. And that all stems from a part of the brain right here in the back which controls all those autonomic functions, the ones we don't have any conscious control over. And add to that memory issues. You may have somebody who has no appetite, so the food is just pushed around on the plate. They hardly eat anything at all. And those are the ones you may need to add supplements to the food to give them more protein. For the ones who eat everything and then think they should eat the neighbour's food as well, especially in day centres, we need to think of strategies. Because often they'll say to you, even though they've got all the crumbs around their mouth, they'll say, I haven't had any. So those people you might only give a portion to while you serve others, and then give them the other part of their meal when they tell you they haven't had any. And you might need to give lots of small snacks rather than big meals. And that's for both whether they're eating a lot or not eating at all. Incontinence, that is part of the disease process, particularly in vascular dementia. But it's a combination of things. So it's not only the brain damage, it may also be the lack of recognition of where the toilet is or how to get there or what it looks like. So leaving the toilet door open so that it's visible is a very good strategy. In an aged care facility, some research was done that showed that if the bathroom door or the toilet door was obscured with a curtain, it got used something like 27 times in a month. When the curtain was opened, it got used something like 200 and something times in a month. So we know that line of sight vision is very important if you want somebody to use something. The other thing is to remind people to use the toilet every couple of hours. Just give them a little reminder, would they like to come here, and show them the bathroom. Because the processing is happening very slowly in the brain, and often the message comes that they need the toilet when they need it, and so they have an accident before they get there. So it's important to recognize that they're not deliberately being naughty, that they're a combination of things, including damage in the brain. And we think it's very important to keep toilet doors shut because it's more hygienic, but it actually doesn't help the person with dementia. Okay. Another strategy might be to put signs on the doors that tell people what's what. It could be a written sign saying toilet, it could be a picture. Aggressive behavior usually is the result of some sort of frustration or anger. And it's not one we can usually just solve in an instant, but we need to think of what's triggering the behavior. And if you woke up every day and had trouble making sense of your world from the moment your eyes opened, you might also feel a bit frustrated and angry. And then because you don't have the regulating mechanism that stops you behaving inappropriately, you might start to hit out or shout or behave in a way that you would call aggressive. And anxiety, again, relates to the fact that most people with dementia really don't understand what's happening to them. And if you were uncertain of what to do next, how to do it, whether you were going to get into trouble for doing it wrong, you would also be anxious. Yeah. I want to just show you 4 things that seem to contribute to behaviors. These are triggers. The first one is around personal issues. So that might be your health. And most people with dementia are older and don't have great health. And you all know when you're not feeling well, you don't behave as well as you normally would. The other thing might be around feelings or around past experiences. Because what's happened to us in the past has a very big influence on how we behave today. And if you're looking at people with dementia who are living a lot in the past, some of their behaviors are very much related to what's happening or they think is happening at that time. Other personal issues might be about how secure or safe you feel or how comfortable you are with the person who's with you. The second thing is around communication, and we've seen how important that is. So if the person isn't speaking clearly or you can't understand them or the words are too difficult, you can understand why that might trigger particular behaviors. Or the environment might have an impact. The sort of room they're in, whether it's familiar, whether they can find their way around, Or it might be around the task that you set for the person. It might be too difficult for them to do. And we think to ourselves, of course they can do it. They've done it 50 times before, but that doesn't mean they can still do it. Or maybe the task is too simple and they think you're treating them like a child. So we've got to be very careful to have a task that is balances with their capabilities. What I want to show you is a problem-solving strategy. It's a model that, even though I can give you answers to specific behaviors, this model is one that's really useful for you to use at home. So the first thing is looking at what is the problem and who's it the problem for? Because sometimes what you think is a problem is actually your problem, not the person with dementias. Like swearing, for example. Does it matter? You worry about it because you think it's not nice. But does it matter if they swear out in public? So sometimes you need to break the problem down and go, how much of it is a real problem and how much of it can I live with? Then you need to look at the problem and go, is there a pattern here? When does it happen? Is it every day? Only when this particular worker's here? In the afternoon? Because once you can establish a pattern, you can usually work out what's triggering it. Then you need to look at all the possible options. Involve other people, the staff that work there, family members, and try and work out which option is going to be the best choice. Once you've established an option and you think it's the best solution, try it out. Then once you've intervened, then you need to work out, did it work? If it was good, tell other people about it so they can use it. If it doesn't work, well then you've got to go to the next best option. But redirection is a very good way of helping the person with dementia. If you can settle the person, then their day will be good. And it might be something as simple as involving them in a task, or going for a walk, or going for a drive in the car, or a bus ride. If you know what the person enjoys doing, and you as family carers know the person better than anybody, you can work out what might be an appropriate diversion. If you can't resolve some of the issue, redirection doesn't work. So if they're really upset and distressed, there's no point in telling them to go and have a cup of tea. They want that addressed. Once you've changed the feeling into being a bit more settled, then you can redirect onto something else. And I want to tell you that music is the best universal language, if you like. Music is close to the pleasure center in the brain, which is why music can lift our spirits, make us feel better, relax us. So I would suggest that that's a really good option if the person is unsettled or if their behavior is inappropriate. Know what kind of music appeals to them. Just points to remember is that everybody is an individual. What works for one person may not necessarily work for another. What works today may not work tomorrow, and some things you can't change. So you need to just accept what you must and change what you can. One of the advantages about dementia is that it's all stages that change. So what may be a challenging behavior for you today may be gone tomorrow. This afternoon we're going to look at services, and I'm going to only talk a little bit about the barriers, and then another lady is coming to talk to you about services in the areas. We know that in recent years the government's spending a lot more money trying to keep people at home. In fact, they've recognised that most people want to stay at home. But of course we know that you can't always care for somebody at home right through to the end. So which of you are using some services currently at home? What services can you tell me about?
they come over and bath my husband.
So home care,
Okay.
transport,
Take him to different,
yep,
daycare.
yep. Daycare is another one. So we've got home care to do domestic things and personal care. And there are a number of other services that we don't hear too much about. Why do you think it's important to keep people at home?
They feel comfortable,
Yes, it's safe,
happy.
yes, comfortable. What about it's familiar? They know where everything is. That means because they know where things are, their independence is maintained a bit longer. But one of the disadvantages is that it takes a lot of time to keep somebody at home. But fortunately there are services to help, to assist in the home. But we need to be aware that we can't have unrealistic expectations about what services can provide. Because we hear about a fantastic service, then we discover it's not in our area, they don't have staff to speak the language, and they can't come on the day we want them anyway. The reasons people give for not using services, I want to just discuss a little bit. Carers or families don't know what's out there, or they don't know how to get started. How do they access these services that they've heard about? Or they think other people are more deserving. They go, no, I can manage, you should go and help so-and-so. Or they think that this is their duty and they should do it themselves. And they feel a bit of a failure if they ask for help. Or they don't like strangers in the house. Or the staff that are sent don't speak the language and so it doesn't work. Or perhaps the person with dementia refuses any help at all. So what are the benefits of using services?
Well, to believe me.
Yes, absolutely, to reduce your stress level and to help you out as a carer. It also is important to reduce isolation for carers, because sometimes they're stuck at home just with this person, and unless they had these workers coming in and out, they wouldn't see anybody for days. Some social engagement for the person with dementia, which means that the person with dementia is able to live at home a lot longer. The first thing is to really communicate clearly what you need from the service. Not only your needs, but the needs of the person with dementia too. It's also important to be aware of what your rights and responsibilities are, because it's common for carers to experience a degree of frustration because services don't exactly meet their needs. But it's hard for the agency to fit exactly the time you want, the carer you want, the day you want, when they have a whole roster to fill. So it's fine for you to complain as long as it's constructive, but you do need to be realistic about your expectations. And be aware that a lot of services have waiting lists, so you will need to wait your turn. But it's actually important that you get people's names down on waiting lists before you need them, so that when you need them, they're ready for you. But there will be a time perhaps when the person will not be able to live at home any longer. And usually a crisis forces the decision. And that crisis might be that the person gets lost out from the home, or damages themselves with the stove, or the health of the carer may break down. And we do know from research that the health of the carers is usually neglected because the carers are so busy looking after the person with dementia that they don't go and see the doctor themselves. Well, sometimes the person has a fall and goes into hospital, and then the hospital makes the decision that they should not go home. But each situation is unique, and so much depends on the carer's coping style, on the support they have, on the family that help them, or even their finances might dictate how much support they call for. So problems that may occur could be opposition from the person with dementia, or worrying about what other people are going to say about you or your family because you've put the person into care. Or other people, family and friends, may not recognize how bad the situation is because they only see the person in a little 10-minute window. Or they come out to the visit once a year and they say, I don't think there's anything wrong with them, I don't know what you're going on about. or it might cause family conflict, or it might be that there are no appropriate services to meet your needs. I think what we're going to do is just talk briefly about technology that can support too. So it may not be services particularly, but you might use an identity bracelet that helps the person not to get lost. Or there's another program which you've all got information on your chairs about a little thing that looks like a mobile phone that's a GPS that the person can carry with them, and you can check where they are. There are also a whole lot of things like pill reminders, lights that come on automatically when you open doors, things that help people to stay home for longer. So if you are forced to use residential care, it doesn't mean that you've stopped caring. But really, care doesn't mean sacrificing everything or stretching yourself to superhuman lengths. So what I'm going to do, because there again is our helpline, I'm going to hand over to Grace.
Now that you've explored some of the benefits, the reason why you have to use services, I'm just going to give you an overview of different services. And just bear in mind that this is just an overview, and also too, my presentation doesn't cover all the services that are out there in the community. These services are going to help you to think about your situation, and because each caring situation is unique, so it is important for you to think about it, talk to someone, and find out more about what's available in your local community. And first of all, when you think about services, you want to start thinking inside of the home. There are services available for older people, people with dementia, their carers in their home. For example, some of you may have heard of domestic assistance, someone to come in and help you with housekeeping. And sometimes I hear older people say, look, I'm really okay looking after myself. You know, I can do vacuum, I can do mopping, but it's a bit hard to just clean up the bathroom. Or sometimes some older people find it really hard to cut some sort of food, which, for example, carrots or meat, because when we get older, our strength is not as good as before, and it becomes a little bit harder to do it. And services can actually provide in a way that suits your need. It doesn't need to be someone coming to the home to do, you know, exactly the same thing. It's all about your needs. And at the same time, then there are other services. Some people don't cook. They might just need someone to help them with cooking or deliver food to their homes. And sometimes some people just think, hang on a minute, I'm really okay most of the time looking after myself in my house. But every now and then, it will be quite good to get someone in to fix the light bulb maybe. Or sometimes when a person is getting weaker, it becomes a little bit unsafe in the home, and you might need some assistance to modify your home. And there is a service as well from the Home and Community Care Program that looks at home modification and maintenance to help you to stay at your own home for as long as possible, and also be safe in your own home as well. Now, some people say, look, I really don't need someone to help me in the home, but it would be quite good if someone could take me somewhere because I can't drive anymore. And taking public transport is quite difficult. And there's a service called community transport, and they would help older people as well as their carers to actually go to different places. It could be, you know, a medical appointment, to a social groups, or to other things. I guess the other important thing to think about is, so what actually works the best for me? Some carers might think, you know, if someone else can go with my loved one to the medical appointment, I would get a few hours for myself. And there is a service called the social support service. And that is actually quite good when the older person not only need transport, but also need some company when they go out somewhere. And even though it's not exactly respite, but it does give the carers a few hours for themselves and to do something for themselves or other things apart from caring. I was at a meeting with a few service providers last week, and we were thinking about what sort of services that the community, especially people from diverse cultural community, actually have limited knowledge about. And one of the biggest sort of issue is allied health services. A lot of people don't know that there is a profession called podiatrist, for example, where people with diabetes might have problems with their feet, and sometimes as we get older the form of our feet might change, or we might need additional support to stay on our feet, and a lot of people actually don't know that podiatrists can help them to actually look after their feet and stay on their feet as well. Some people don't know that there are dietitians who could give you practical advice about what to eat, what to avoid. And I do know that a lot of people who have previous experience with dietitians tend to say, I don't want to see them because they just tell me not to eat this, not to eat that, and not to eat altogether. But it is not true, because our dietitians actually will work with you based on your everyday lifestyle, what kind of food you actually consume on a daily basis. What sort of preferences do you have, and work with your diet to make it relevant to you, because we've learned it the hard way over years. We know that if we try to change people's diet, especially if they are from a diverse cultural background, it's just not going to happen. And a lot of people don't know that we actually have dietitians in the community to help carers to manage the diet of their loved one as well. Other services, occupational therapists or physiotherapists, there are plenty of services in the communities. And I think it is really hard for family members or the older person to actually decide what services most suit their needs. And the important thing is you do have to be aware that there are people you can talk to about your situation, about your needs, and they would help you to actually find the most suitable service. So I've got here a booklet called the Home and Community Care Handbook for Carers and Consumer, and you can download this booklet from the website. And apart from services that are in the home or bringing people to different places, we have services that bring people outside of their homes as well. For example, their aged day care centre. Some of you might have experience using aged day care centre, and there are aged day care centre for older people. There are aged day care centre for people with dementia specifically as well. And apart from that, there are different groups in the community that people can join. For example, some seniors group, they might have activities that suit different needs. There are carer support groups in the community, and you can actually attend those groups to get some support from others, to learn about what other people are doing, how they manage their situation. And that's a really good way to also find some friendship and also break down social isolation, because we do know that social isolation is a very big thing for people with dementia as well as their family. But I understand that it is really hard for you to sort out all these services. So we do have a service called the Information Support Counselling and Referral Service. And these are people who are on the other end of the phone or face-to-face who could help you sort out these services. And they could provide you with counselling or refer you to appropriate counselling services if that suits your need. One of the important things is that we do have volunteers who speak different languages. So if English is a challenge and you wanted to talk to someone in your own language, you can give us a call. Another thing for you to remember is that all service providers in the Northern Sydney area can have access to the healthcare interpreter service. So it doesn't matter whether you approach Pam's service or my service or other services in this area, they could provide you with an interpreter. So if language is an issue, you just need to let them know the language you speak and how they can contact you. And it is really important for you to let them know that you need an interpreter early, because you can't actually get an interpreter straight away, or the interpreter can't just run to you at the time you need them. So if you let services know that you need an interpreter, then the service would be able to organize it for you. Thank you very much for coming here today, and just remember to not to be afraid to approach services, because services are here to help. Just ring up and I'm sure that we can do something to help you.